Hello and welcome to the Deep Dive.
Hello.
Today, we're embarking on a really fascinating journey, I think, into the world of a specific homeopathic remedy, Causticum.
That's right.
Our mission, as always, is to really extract the key nuggets of knowledge from a whole stack of sources we've got. We have everything from a retrospective study on Causticum and stroke recovery to detailed explorations of its unique properties, its sort of emotional and physical characteristics, and even broader insights into homeopathy itself. So get ready, because you might uncover some surprising facts and connect some dots you hadn't thought about.
Absolutely. Our deep dive today will explore how Causticum is understood and applied, from its core identity in the Homeopathic Materia Medica, which is basically the guidebook for remedies, all the way to its observed effects in specific clinical settings.
Okay.
And we'll also touch on some of the fundamental concepts, some quite debated ones, actually, that underpin homeopathic practice.
Okay, let's unpack this then. What exactly is this remedy, Causticum? What makes it stand out?
Well, that's actually one of the first really intriguing things about it. While its exact chemical makeup, it remains unknown in conventional terms.
Right.
But its healing properties are, remarkably well documented within homeopathy itself. It's considered a deep-acting remedy.
Deep-acting?
Which basically means it's thought to address chronic conditions, things with symptoms that progress over time. And quite powerfully, our sources note that often just a single minimal dose is said to be enough to sort of kickstart a healing response.
Wow.
Yeah, and its applications are surprisingly wide-ranging, from physical stuff like coughs and paralysis to quite deep emotional distress, which we'll definitely get into. It's often seen as a real testament to Hahnemann's original insights, the founder of homeopathy.
So if it has such a broad reach, who is the person typically who might truly benefit from Causticum? What does the remedy's sort of persona look like?
Okay, so based on the sources, the Causticum individual, if you like, tends to be quite serious, sensitive, and deeply empathetic. They get easily disturbed by injustice, particularly when it's directed at other people, and they can be really susceptible to long-lasting grief. Now, when they're balanced, these individuals are often described as happy, idealistic, even optimistic, but when they get unbalanced or, unhealthy, they can really fall into gloom.
Right.
They also have this really strong sense of social justice, and that can sometimes manifest as an intolerance to authority, which kind of sets them apart from other remedies like, say, staphysagria.
That's a really vivid picture, and I was struck by how one of our sources mentioned this interesting idea, this saint or strategist duality.
Yeah.
How does that sort of thing play out?
Yes. That's a fascinating insight, isn't it? It really gets to the remedy's complexity. So our sources give us a couple of powerful examples to illustrate this. First, you could picture a middle-aged woman, maybe someone who's dedicated her whole life to caring for a disabled child, or perhaps a sick parent.
Right, the saint, perhaps.
Exactly. She might appear emotionally strong, a real pillar of strength in her dedication. But underneath, you see signs of deep fatigue, frustration, maybe this silent resentment building up. She might cry easily, and sometimes it's described as seeming both genuine and a bit performative. And physically, maybe she suffers from a chronic sore throat or an inability to cry when she really needs to, or perhaps trembling hands.
Wow.
These are all reflections, really, of suppressed emotion and that kind of moral stress. It's a classic Causticum picture of someone just trying to bear too much weight.
A saint pushed right to their limit almost.
Yeah.
So what about the strategist side of that coin then?
Right, the other side. So the other example might be, say, a man involved in activism or politics, someone who maybe started with noble ideals but has kind of lost touch with that initial passion. He's become embittered, maybe rigid, cynical. The strategist who might even start justifying unethical actions by claiming, it's for the greater good.
I can picture that.
And his nervous system starts showing the strain, maybe through tremors, perhaps facial paralysis, or just chronic hoarseness. So this dual identity really highlights how the remedy can address both these deeply sympathetic aspects and the rigidly strategic ones, often when that initial idealism has been, bruised or corrupted somehow.
So it definitely sounds like Causticum is particularly suited for these heavy emotional burdens like long-lasting grief and sadness, the kind that often stay hidden.
Absolutely.
But what's fascinating is how these profound internal states, they don't stay hidden forever, do they? They often manifest physically. How do these emotional imprints translate into actual physical symptoms? What are the key physical signs that really point towards Causticum?
That's a great question, yeah, because in homeopathy, the mind and body are seen as completely intertwined. So typically the nervous system, the muscles, and connective tissue are the first areas to show physical symptoms with causticum.
Okay.
It's a prominent remedy for conditions that involve a gradual onset of problems. Things like locomotor ataxia, that's a problem with muscle coordination. Right.
Myopathy, diseases affecting the muscles themselves, multiple sclerosis, and myasthenia, conditions that cause muscle weakness over time. So it points to quite a deep impact on the nerves and muscles.
Okay.
And a very, very characteristic feature is the paralysis of local organs.
Local organs.
Yeah, so this could mean things like facial paralysis, maybe dysfunction of the esophagus, making it hard to swallow, uncontrolled drooping of the upper eyelids, stammering because the tongue isn't working right, biting the cheeks while talking or chewing,
Oh, wow.
or even paralysis of the bladder sphincter muscles or the extremities.
I can imagine that would lead to some very specific and certainly uncomfortable day-to-day symptoms.
Indeed, yeah. One of the absolute keynotes for causticum is involuntary urination, often triggered by simple things like laughing, sneezing, or coughing.
Ah.
And that's due to that localized paralysis we just talked about. Another common thing you see is warts, especially on the face and often on the fingers, near the nails.
The cough is also quite distinctive. It's described as hollow, hard, and dry. Often feels like it comes from a tickling sensation deep in the throat pit, and there's this feeling of rawness and soreness behind the breastbone. The person feels like, oh, if I could just cough a little bit deeper, I could get something up, but they can't, which leads to this constant throat clearing and just utter exhaustion from coughing.
Gotcha.
Interestingly, it's often better from cold drinks or in wet weather, but worse in cold air. And you also see hoarseness, even loss of voice, which is typically worse in the morning.
Okay. What about pain or other general sensitivities in someone who might need causticum?
Yeah, rheumatic pain is common, especially in the small joints. And it has this peculiar pattern. It's typically aggravated by cold bathing, but actually feels better in wet weather or with heat. And quite notably, it's much better from the warmth of the bed and better in the morning.
Which is unusual, right, for rheumatic pain?
Exactly. Very unusual. Most people with rheumatic pain feel worse in the morning. People needing causticum are generally very sensitive to cold in all its forms, even slight drafts, which can really aggravate their stiffness and any paralysis they have.
Okay.
They also often experience this real restlessness at night, just can't find an easy position, can't lie still. But, and here's the paradox, while they must move constantly, the motion itself doesn't actually bring any relief.
That sounds difficult. So we've covered a whole range of symptoms, from chronic coughs to these specific paralyses. But does causticum also have a role in more, say, acute or dramatic situations, like seizures?
It can, yes. In seizure presentations, causticum might be indicated if there are auditory hallucinations, hearing things like buzzing or roaring noises or tinnitus.
Okay.
Sometimes the seizures might be preceded by screaming or maybe a sensation of cramp or pressure right at the pit of the stomach. The seizures themselves often involve more convulsive movements in the limbs. The head might be drawn to one side, that's called torticollis, and they often affect one side of the body more than the other. And again, that involuntary urination during the seizure is a very strong characteristic for causticum.
Right.
Other signs could include things like frothing at the mouth, teeth grinding, tongue biting, eyes rolling, sometimes nosebleeds, or the eyes becoming fixed.
Okay, we've built a pretty strong picture now of the causticum person and their physical symptoms. Now, let's take these insights and see how they might play out in a real-world scenario that, well, might surprise you a bit: the application of causticum in stroke rehabilitation.
Ah, yes.
This sounds incredibly important, especially given that stroke is such a major global health issue.
It absolutely is. Stroke, or CVA, Cerebrovascular Accident, causes huge long-term disability. It affects daily activities, thinking, communication for millions of people around the world.
Yeah.
Standard rehabilitation, it aims to maximize functional independence and minimize those disabilities. Usually involves a whole team, doctors, therapists.
Right.
But our sources highlight that patients, quite understandably, often look for additive options, complementary approaches that might work alongside their mainstream care to just optimize their quality of life.
And this is where the study on Causticum comes in.
Exactly. This is where it fits.
So tell us about this study. What were they trying to find out, and what were the results?
Okay, so this was a retrospective study. It was done at Cerebrovascular Homeopathic Medical College in India. Now, it involved a pretty small sample, just 5 post-CVA cases.
5. Okay.
Yeah, just 5. Included patients of different ages, both sexes, and they had both acute and chronic conditions following their stroke. The method was basically collecting their data and doing follow-ups to see if there was improvement. They used tools like the Fugl-Meyer assessment, the FMA scale, which is a standard index used to assess sensorimotor impairment after stroke. Basically, higher scores mean better function.
And the findings, what did the data actually show?
Well, the study's conclusion, and I'm quoting here, was that it highlights the efficacy of Causticum in improving rehabilitation outcomes following a CVA, paving the way for future research into the potential role of homeopathic remedies in the holistic care and recovery of stroke survivors. And visually, if you looked at the data they presented in bar charts, it consistently showed improvement. Better motor function in arms and legs, better sensory function. The after-treatment scores were generally higher, more positive, compared to the before-treatment score.
That certainly sounds promising, doesn't it? Especially given how challenging stroke recovery can be. But with only 5 cases, I imagine there were some pretty important caveats or considerations when we look at these results.
Oh, absolutely. You're right to point that out. And the study itself is upfront about its limitations. It acknowledges these are essentially anecdotal reports, case studies. It really stresses the crucial need for, rigorous prospective studies, things with much larger sample sizes, proper control groups, standardized methods, all the things you need to firmly establish efficacy in conventional research terms.
Makes sense.
It also highlighted something core to homeopathy, the individualized nature of the treatment. Each of those 5 patients responded uniquely to Causticum based on their specific picture, which just underscores the need for that really personalized approach in homeopathy. It's definitely more of a starting point for more questions rather than definitive proof.
So it opens a door for potential future research. But the core principle still seems to be this highly individualized approach. Okay, let's zoom out a bit then and try to understand the foundations. How do homeopaths actually discover these remedies and their specific actions in the first place? Where does this information come from?
Right, good question. It all really starts with the core principle, like cures like, or in Latin, similibus curentur.
Like cures like.
Yeah. The idea is that a patient's unique set of symptoms, their whole picture is matched to a remedy that, if given to a healthy person, would actually produce similar symptoms.
Okay.
And the process of discovering what symptoms a remedy produces is called approving.
Approving?
So, in approving, healthy volunteers take a substance, often in one of these ultra-diluted forms we'll talk about, and they meticulously journal every single symptom they experience. Physical, mental, emotional, everything, over weeks or months.
Wow. Detail.
Very detailed. Historically, they even had strict rules like no coffee, no tea, no strong spices, no wine. Hahnemann even advised against playing chess because he thought it was too exciting and might interfere.
Chess, okay.
Yeah, so these incredibly detailed symptom records from healthy people, they then formed the basis of the Materia Medica. Those are the big reference books homeopaths use to find the right remedy match.
Okay, and this brings us neatly to the perhaps the most talked about aspect, the dilutions. This often sparks a lot of debate, a lot of skepticism. Can you walk us through how homeopaths explain this concept? Yeah. Especially given the extreme dilutions involved sometimes.
Right. This is definitely a central point and often a controversial one. So Hahnemann, the founder, believed that using substances in their raw, undiluted form could sometimes cause strong, even dangerous reactions or aggravations. So he advocated for using the lowest possible material dose.
Okay.
Now, here's the counterintuitive part in homeopathy. A more dilute solution is actually described as having a higher potency.
Higher potency means more dilute.
Exactly. And it's claimed to be stronger and deeper acting in its effect on the body's vital force. The remedies are prepared through serial dilution. So you take one part of the substance, mix it with, say, 99 parts of solvent like alcohol or water, shake it vigorously. That shaking is called succussion, and it's considered crucial. Then you take one part of that mixture, add 99 parts fresh solvent, shake again, and repeat. That process creates a C's potency, like 6C, 12C, 30C, 200C.
Right.
There are other methods, too, like the Corsicovian method, where they just empty the vessel and refill it, relying on the bit of fluid that clings to the walls. Or trituration for insoluble things like metals or minerals, where they grind it down with lactose powder.
Okay, you've laid out the process, but I know the criticism often focuses on the sheer mathematics. That at certain dilutions like 12C or especially 200C, it's statistically almost impossible for even one molecule of the original substance to remain. How do homeopaths address that scientific sticking point?
Yeah, that's the crux of the scientific skepticism, absolutely. And from a purely chemical material standpoint, that criticism is mathematically sound. The example often used is that a 12C dilution is like a pinch of salt in the Atlantic Ocean, or for 200C, the numbers become astronomically improbable for finding an original molecule. So from the homeopathic perspective, the explanation shifts away from a purely chemical or molecular action. The theory is that the process of serial dilution combined with that vigorous shaking, the succussion, at each step. Well, it's believed to somehow impart an energetic imprint or pattern or information from the original substance onto the structure of the solvent itself, like the water or alcohol.
An energetic imprint.
That's the idea. So it's not about the material presence of the original molecules in the final dose, but about this transmitted pattern or energy that is then thought to interact with the body's own vital force or self-healing mechanism, which we can talk more about. So they'd argue it's working on a different level, an energetic or informational level, rather than a pharmacological one. It's definitely the point where homeopathy diverges most significantly from conventional chemistry and physics, and it remains the most controversial aspect.
Okay, so if the effect isn't necessarily chemical in the conventional sense, that brings us to this idea you mentioned, the body's own healing capacity or vitality. How does homeopathy view this internal force?
Right, the vital force or vitality. It's a really central concept. It's essentially seen as the body's innate intelligence, its life energy, that sort of self-regulating, self-healing power that keeps us alive and aims for balance. Think of it as your internal health manager.
Yeah.
Homeopathy suggests that changes in this vitality, subtle shifts, often show up even before clear illness develops. And it's through gently nudging or stimulating this vital force that even these highly diluted homeopathic medicines are believed to exert their effects.
Right.
And homeopaths often use different models of health to understand a patient. It's not just a simple pathogenic view like something's broken, let's fix it. It can be more holistic, considering the person's overall susceptibility, their patterns, the totality of their symptoms as part of a dynamic process.
So sometimes getting sick might even be seen as part of the process.
Exactly. From this holistic viewpoint, sometimes the body actually needs to move out of balance temporarily to find a new, healthier balance. So even getting ill isn't necessarily just a negative thing. It can sometimes be part of the body's way of staying healthy in the long run.
So it's clearly not just about matching symptoms to find the right remedy. It's also about understanding the patient's whole context, their unique story, their inherent strength.
Precisely, yes. A big part of the process is identifying potential obstacles to cure.
Obstacles to cure?
Yeah, this could be anything, really. Obvious physical things like ongoing trauma or maybe a really poor diet. But it can also be psychological factors. Maybe someone is consciously or even unconsciously sabotaging their own treatment or recovery for some reason. These need to be addressed for healing to happen.
Right.
And the choice of the remedy's potency and how often it's given also depends on the whole case. Lower potencies, like a 6C or 12C, are often used for simpler cases, maybe acute things with clear causes and symptoms.
Okay.
Whereas higher potencies, like a 200C or a 1M, that M means 1000C, so even more dilute. Wow.
Those are typically reserved for more complex chronic cases, often chosen based on those deeper, holistic or thematic patterns we discussed. And these higher potencies are usually repeated much less frequently, sometimes just once.
And what about side effects or reactions?
Well, sometimes there can be what's called an initial aggravation, a temporary worsening of the existing symptoms shortly after taking the remedy.
A worsening? That sounds bad.
It might seem counterintuitive, but in homeopathy, it can actually be seen as a positive sign. It suggests the remedy is a very close match and is stimulating that vital force strongly. It's often more likely if the patient has strong underlying vitality. And the ultimate goal, the ideal direction of healing, is always guided by something called Hering's Law of Cure. Hering's Law, that sounds intriguing. What's the roadmap there? How does that work?
Yeah, Hering's Law provides a kind of framework for how true healing is believed to progress. The idea is that symptoms should resolve in a specific order.
Okay, what order?
Usually, it's expected to happen in the reverse order of their appearance. So the most recent symptoms tend to clear up first and the oldest ones last.
Okay.
Also, healing is thought to move from the inside out, so from deeper, more vital organs towards the surface, like the skin, and from top to bottom, maybe head symptoms improve before limb symptoms, and crucially, from more important functions to less important ones.
Right.
But the very first and most important sign, according to Herring's law, is an overall improvement in the person's sense of well-being, their energy, their vitality, even if some physical symptoms are still lingering. That improvement in overall vitality is seen as the key indicator that genuine healing is underway.
It really is fascinating how homeopathy looks for these deeper patterns and connections. You mentioned a couple of other concepts earlier, signatures and miasms. What do these add to this whole picture of health?
Right, signatures first. The doctrine of signatures is an old idea, actually predating homeopathy, but it's sometimes used. It's the notion that the characteristics of the source material itself, what it looks like, where it grows, its properties, can give clues about its therapeutic uses.
Like clues from nature.
Exactly. For instance, the remedy Calcarea carbonica. It's made from the middle layer of an oyster shell.
Okay.
So the signature thinking is that it might be useful for individuals who feel kind of weighed down, maybe insecure, needing protection, perhaps have fears related to their fixed existence, a bit like an oyster stuck in its shell. It's a way to bring a more cohesive, imaginative picture to a remedy's symptoms beyond just a dry list.
I see.
Similarly, hyoscyamus, which comes from the plant henbane, has a certain signature that helps homeopaths understand its particular psychological and physical effects, going beyond just the stereotypical descriptions you might find. It adds another layer of understanding.
Okay, that makes sense. And miasms, that sounds quite complex. How do they fit into this framework?
Yeah, miasms are definitely a more complex and sometimes debated concept within homeopathy. Think of them as sort of deep-seated, inherited, energetic blueprints or predispositions towards certain patterns of chronic illness.
Inherited patterns.
Yeah, or acquired. Hahnemann originally described three main ones. There's sora, often linked to deficiency, hypofunction, itchiness, sort of disturbed self-regulation. Then psychosis, which tends towards excess, overgrowth, things like warts, growths, maybe duplicities, and syphilis, associating with destruction, degeneration, deep pathology, ulceration.
Right.
Later on, other miasms were proposed, like a tuberculosis miasm, often seen in people who are restless, always seeking change, maybe have a kind of revolutionary genius quality, but burn out easily. And more recently, carcinosin, which is often linked to personalities with a history of suppression, maybe perfectionism, a kind of disease to please.
And where does causticum fit in?
Causticum is often linked to the syphilitic miasm, which makes sense given its strong association with degenerative conditions, paralysis, and that deep sense of injustice or breakdown. So these miasms provide a kind of theoretical framework for understanding the really deep layers of chronic illness, especially when a case seems stuck or confused, despite well-chosen remedies. They're sometimes seen as underlying obstacles to cure that need to be addressed for full healing.
It's certainly clear that homeopathy takes this very individualized, very holistic approach to human health. Are there other, maybe less obvious applications where you see these principles playing out?
Yes, actually, a striking example sometimes comes up in veterinary homeopathy.
For animals?
Exactly. The same principles like cures, like the whole symptom picture, are applied to animals. And our sources mention cases where a pet's symptoms can seem to mirror the emotional state of the household.
Really?
Yeah, like a case of a dog needing causticum for arthritis and maybe hind leg weakness that developed after the loss of the main head of the family. The idea is that causticum carries this theme of protection of the family unit, and the dog's physical symptoms might be reflecting the grief or instability in the human family.
Wow, that's fascinating.
It is. Now, some practitioners might use general breed constitutions, like, golden Labradors, often tending towards Calcarea carbonica characteristics. But it's always stressed that, just like with humans, a truly individualized approach, looking at that specific animal's unique symptoms, history, and personality is always the most crucial thing.
What a deep dive into causticum. Really fascinating. We've unpacked its core properties, we've explored its pretty unique emotional and physical profile, and we've seen its, intriguing application in stroke rehabilitation. And we've also touched on those fundamental principles of homeopathy itself, from provings to those very controversial dilutions, and its broader applications in looking at emotional healing and even helping our pets.
It's definitely a reminder, isn't it, that healthcare can take many different forms, and that really trying to understand the multifaceted nature of health and healing, it just opens up new possibilities and encourages us, I think, to look beyond just the superficial symptoms sometimes.
Indeed. It makes you think. So what might it mean for you personally if your illnesses, your struggles weren't just random events, but perhaps were more like a map or even a kind of language, revealing something deeper about your own unique story, or maybe even about our collective human patterns and susceptibilities? Definitely something to mull on as you go about your day.